Okay, thank you, Professor Sanda, and I would also like to thank the organizers for inviting me in this Congress. I didn't understand what has been said, but I picked up one word, that's anthropology, about me. Yeah, that's right. As you know, my background is anthropology. I actually moved from, I was a clinician, then an epidemiologist, and then moved to anthropology. So I became more interested in stories than numbers and things like that. So I'll start by telling a story. And of course, as I'm from Bangladesh, I'll be telling a story from Bangladesh. Unfortunately, I mean, in contrast to this bright picture of a Bangladeshi village, there are, of course, quite a darker side of Bangladeshi villages. It is, of course, highly poverty-stricken, and it has one of the highest infant and maternal mortality rate. I'll talk about one of these deaths that takes place every day, the hundreds and thousands deaths of a child that takes place in Bangladesh. So this is a graveyard of one of the small baby whose name is Babu, and he lived just for 5 days. When I was working as a public health physician in the villages, in rural areas, I used to see several of these small graveyards of small babies. So I just wanted to know what was the cause of the death of this baby. And this was not a very unusual, uncommon story. And so when I asked the mother just to know what happened and how the baby died, or rather, a child should not die so early. So I thought whether I should ask who killed this boy, Babu. So as the story goes, I mean, this is a family it's a very poor family, a husband and wife, and the parents of that family. I mean, parents of the husband, father and mother. They have a very small land, poor, they're not literate. Only the girl went for an informal education for a few years. So as it happened, I mean, when she was pregnant, she knew that she needed to take tetanus toxoid. So and in our villages, there are small satellite centers where the people come to vaccinate. But it's not easy for a woman to go alone to that far, so she wanted to convince her husband to take her to that center. So the husband, after persuasion, husband agreed to take her to the center. But when she went there, there was no staff at that day to vaccinate her, so she couldn't be vaccinated. So she came back, and it was not possible for her to go to get the husband to accompany her again. So at the end, she couldn't get the tetanus vaccination. So when the baby was born, as per the ritual of that village, they call traditional birth attendants, and it's the ritual that if it is a boy, then they cut the umbilical with a special knife, that's a fish cutting knife, with the belief that when the boy grows, he will catch a lot of fishes. So they all were happy that the baby is born and it's a boy. But just after 2 days, the boy started to become blue and red and stopped sucking the breast, and also had a very high fever. So the mother was, of course, very anxious, and she wanted to take the baby to the clinic, health center. But and health center was very far. But it was the father-in-law, I mean the father of the husband, who makes the decision? So he said, no, the baby will stay at home and I will take care of him. So he started to recite Quran and pray, and also throw holy water to save the boy. But of course the boy didn't improve. So at a certain point they decided to, again the father-in-law, the grandfather decided that he would be taken to a traditional healer in that village. And the traditional healer came and he gave some herbs, but the boy didn't improve. So at that point they decided to take him to the clinic. But of course the clinic was quite far, and they need money to go to the clinic. We don't have insurance system or things like that, and they didn't have money, so it took some time to collect the money. So when the money was collected, they decided to go, but it was quite far. There's no transport and there's no good road. So they had to hire a, we call it rickshaw van with a tricycle. So they took the baby with the rickshaw van. It was of course very slow, and eventually the baby died on its way. So that's the story of the 5 days life of Babu. And I of course wanted to understand what was the cause of his death. And as you all can understand, definitely the cause of his death was tetanus. The medical cause was tetanus. But of course I can say that if the woman or the girl would have been vaccinated in time, maybe the boy would have been saved. And there was she didn't get the tetanus vaccine. She also didn't get a skilled attendance for her birth. So I may say that it's an issue around health services, and the cause of the death, Babu's death, was health services and the problems with the health services. If the mother could take the baby to the clinic on time, maybe the baby would have been saved. But she couldn't because she doesn't make the decision. So this is an issue of power relation. So it's the father-in-law who makes the decision. So there's an imbalance in power relation. And as we have seen that the father recited Quran because he depended on spiritual healing, and when the spiritual healing failed, he relied on traditional healing. So there's an issue of cultural belief and issue of health-seeking behavior as well. But then when they decided to take the baby for medical care, they didn't have money. And very obvious, poverty is a major cause. So I also may say that poverty was the cause of Babu's death. And even if they had money, when they had money, if they could transport the baby quickly, maybe he would have survived. But there's no good road, no transport. So it's an issue of